How can I stop coughing after lung cancer surgery? Experiencing a cough after lung cancer surgery is quite common and can be frustrating, but there are effective ways to manage it. Coughing often persists because of irritation or injury to nerves and tissues during surgery, especially after procedures like lobectomy or lymph node removal. Factors such as longer anesthesia times and specific surgical techniques can increase the likelihood of a postoperative cough. While it can last 4 weeks or even longer, understanding your options can help you find relief and improve your comfort during recovery. First, medical management plays a key role. Your healthcare provider might prescribe medications to suppress your cough, such as cough suppressants or drugs that target nerve sensitivity. If acid reflux is contributing to your cough, treating it with appropriate medications can make a significant difference. Managing pain effectively is also crucial because pain can trigger or worsen coughing. When pain is well controlled, coughing tends to decrease naturally. Behavioral and supportive therapies are also very helpful. Learning cough suppression techniques from your healthcare team can help you consciously reduce episodes. These might include controlled breathing exercises or relaxing your throat muscles. Staying well hydrated by drinking plenty of water can soothe your throat and lessen irritation. Using a humidifier in dry environments adds moisture to the air, which can help keep your airways moist and reduce the urge to cough. Deep breathing exercises and airway clearance techniques, such as gentle postural drainage, can help clear mucus and prevent coughing triggers. Patient education is important too. Understanding that coughing is a normal part of recovery can reduce anxiety and help you feel more in control. Some patients find that psychoeducational support or counseling helps them cope with the emotional impact of persistent cough, especially if it affects their social interactions or sleep. Regular follow-up with your surgical and oncology team allows your care providers to monitor your cough and adjust treatments as needed. They can help identify underlying causes like infections or acid reflux and treat them promptly. Remember, every patient's experience is different, so personalized care is essential. In summary, managing cough after lung cancer surgery involves a combination of medication, behavioral strategies, supportive care, and ongoing medical follow-up. Always consult your healthcare team before starting any new treatment or therapy. They can provide tailored advice based on your specific situation, helping you recover more comfortably and regain your quality of life.